We are back. Case study 3 continues. The short-term goal for the 3 patients are to maintain proper health through the right exercises, diet, and self-regulating proper posture exercises. The long-term goal is to address the overall well-being, addressing other lesions listed above by possibly referring them to other specialists and checking and seeking a more balanced quality of life. Client A could improve a lot by attending monthly or bi-monthly massage in combination with the manual osteopathy sessions, by checking with the orthoped and getting prescription for the insoles. Also, the ergonomies would come handy in adjusting her computer desk for a better wrist position. A good idea is to seek correct exercises from a physiotherapist to establish an improved muscle balance. Patient B would benefit from the same as listed above. However, since he loves working out, a personal trainer would come useful to improve muscle balance exercises and in order to not overload his bicep tendon. Patient C should and will be coming for more sessions to address his long-term chronic scar and try to get more time resting from work. Dietologists and gastroenterologists would come useful for the visceral problems he is experiencing. All of the subjects of the study would be encouraged and instructed in fascial stretches and elastic recoil exercises in order to promote healthy circulation and fascial glide within the whole body. There are some limitations in the research as the study was narrowly focusing on the effectiveness of the osteopathy fascial remodeling of the scar in just 3 sessions. However, we weren't addressing the holistic approach to the health of the entire body. There are clearly more treatments needed to bring balance throughout all the lesions of the body. Looking at the tensegrity principles, the changes that are being produced, though very locally, will affect the rest of the body. In that, we have confidence that though we remodel that specific scar in the body, it will and should contribute to alleviating the fascia chain lines of the rest of the body. For further studies, the therapist would most likely choose a greater sample size of participants with similar lesions, classify them into first, second, and third category by the severity and by the age of the scar, and then examine and treat each one over the period of 1 year to be able to see if the improvements of the corrections are temporary or longer lasting. The role of osteopathy is crucial in the recovery process of the client. However, it is within the scope of our practice of the manual practitioner to seek an integral approach towards healing, and therefore other healthcare practitioners such as medical doctors, physiotherapists, gastroenterologists, occupational therapists play a very important part in achieving the desired results. Conclusion. In this case study, the therapist has gained significant clinical knowledge of assessment, palpation, observation, and treatment skills. We've put to the test the osteopathy fascia diagnosing and remodeling techniques that are used to treat various scar tissues. The lesson learned from the case study is that there is a correlation between the age and the severity of the scar and the recovery rate. We see how full remodeling of the fascial lines and the lesions depend on time spent and effort put in. Fascial lesion takes time to remodel. However, on a positive note, the more effort the therapist will put in, the longer lasting the result will be. The patients were content with the results of the study as they noticed improvement even in other areas of the body. Finally, the experience that we have gained in this study translates into the tool set of knowledge, allowing the therapist to use it freely for utilization in our future clinical practice when treated patients with the similar scar lesions. Thank you for your attention.